This week we're talking colorectal cancer awareness. This cancer is the third most common cancer in the world. To learn more, we turn to UofL Health's Dr. Nathan Liu. Thank you so much, doctor, for taking some time with us today.
Thanks for having me today.
So we know you're a GI surgeon. You deal with this a lot. What are some of the signs or symptoms that people might notice?
I think the biggest thing is if you're starting to have new onset abdominal pain, blood in your bowel movements and stool, I think it's time to talk to a doctor and make sure that you don't need to have a colonoscopy and have a look.
We know screenings are so crucial here. What does the screening process look like and why are they so important?
Yeah, so what's really important now is that we have a bunch of different ways to get screened. The USPSTF has changed the guidelines, and actually 45 years old is the new age that everyone should be screened. So you should start at 45. It used to be 50, and because of all the new early age onset colon cancer that we're seeing, they've lowered the screening to 45. So at age 45, you should get screened. In terms of the different tests that you can do, one of them is called Cologuard. That is just a stool-based test where you can send a sample off and then they tell you if you need a colonoscopy afterwards. If that test is negative, it buys you 3 years. The other thing you can do typically is a colonoscopy, and that's where your doctor actually takes a look inside your colon. It's the only therapeutic and diagnostic procedure that we have, meaning the doctor sees polyps and then they can remove the polyps at the same time. So that way you can actually get it taken care of. If you do have a positive Cologuard, the next test you do is a colonoscopy anyways. So we always say some screening is better than no screening at all, so just make sure you get taken a look at. With the colonoscopy, the hardest part is always drinking the bowel prep, but then the actual procedure itself is quite painless and harmless, and you'll be completely asleep as well too.
And is that first test, the Cologuard, something you do at home?
That is something that you do at home. You go to your pharmacy, they give you a box, you go home, and then you collect a sample, and then you send it off in the mail. And then the company sends you a packet letting you know if your results are positive or negative. Typically what it's trying to do is detect if there's any microscopic abnormal DNA in your stool that might prompt you to need a colonoscopy afterwards.
Okay, good to know, and people love at-home options. So we just have a little bit of time left. Is there anyone more at risk here?
So anybody that has a family history where they have a family history of colon cancer, you should start screening at least age 40. If you have family members with multiple polyps, you should also take a look at getting screened early as well too, or if you have any symptoms as well too.
Okay, Dr. Liu, thank you so much for coming on.
Thanks for having me.
We really appreciate it.
Appreciate it.